Well, good afternoon, everyone. It's pleased to see that all the members of the band are back today. All three people, all three of us are sitting at the desk here today. So, as we normally do, we will start the event today by turning it over to Dr. Fitzgerald for her update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we have no new cases of COVID-19 in the province, and the total number remains at 261. In total, we've tested 19,475 people. So it's been almost a week since we joined the Atlantic bubble, and we continue to monitor closely the epidemiology of COVID-19 in our province and in other provinces and jurisdictions as well. As we await a vaccine or effective treatment for COVID-19, we are confident in our ability to safely restart social and economic activities in our province, and we are working hard to strike a balance between resuming these activities and ensuring the proper measures are in place to limit both the health and societal impacts of this pandemic. We have done exceptionally well containing COVID-19 in Newfoundland and Labrador, but as I've said before, the expectation of 0 cases throughout the remainder of this pandemic is neither sustainable nor realistic. Our continued success in controlling the spread of this virus depends on each of us. And while public health does its part by providing expert guidance based on the best available science and evidence, please continue to do your part as well. Stay home if you feel unwell. Practice good cough and sneeze etiquette and hand hygiene. Maintain a safe physical distance of at least 2 arms lengths from others when in the workplace or public spaces, and wear a non-medical mask when it is not possible to do so. Just because we have no active cases right now does not negate the need to continue practicing these preventative measures. They have served us well to date and remain our best line of defense against COVID-19. COVID-19 will be with us for a while, and until a vaccine or effective treatment becomes available, the threat of this virus is still very real. We can mitigate this risk and continue to do the activities we enjoy, but only if we make smart, responsible, and informed choices. The decisions we make now will impact how COVID-19 looks in our province in the coming weeks and months. So as you go about your daily routine and enjoy activities with family and friends, please remember the greater number of people you interact with, the greater the risk of spreading COVID-19, and to avoid or limit the amount of time spent in high-risk settings, including spaces with poor ventilation or crowded places with large numbers of people gathered. As a recap, for those who may have just joined, we have no new cases since yesterday's media advisory, and the total number of cases in the province remains at 261. COVID-19 has presented us with challenges, but also with many learnings. We have learned that together we can face and persevere through incredible hardship, and when the chips are down, we come together without hesitation to support our neighbors, our community, and each other. We are also discovering how to make the most of what this new way of life has to offer without losing the best of the old. That is spending quality time with loved ones and friends and doing things we enjoy in a safe and responsible manner. As we wait out the end of this pandemic, let us continue to protect the freedoms we have regained and one another. We can do this, and we will do it together. Thank you.
Well, thank you, Dr. Fitzgerald. It's not every jurisdiction can say that they've made it to 41 days without seeing a new case of COVID-19. And not only can other jurisdictions say that it's been 21 days since they've seen an active case. We can say that in Newfoundland and Labrador. So on behalf of all of us, and especially as Premier, I can say that we're extremely proud of what we've all accomplished. Dr. Fitzgerald and our public health officials have been working, as you know, tirelessly since March to put important health measures in place to protect you and your families. You have listened. Newfoundlanders and Labradorians has responded. You've been compliant, and you have followed the guidelines. And you are to be commended, no matter where you live in our province, for the work that you've done. We have made great strides in our plan to live with COVID. And while we see most residents and most businesses adhering to the public health guidelines, there are a few, which is not unusual, that we'll see in some of the media reports that simply have not. And so all of us as a province, we feel the disappointment on what took place over this weekend here in St. John's. We all know that you have worked hard, and reports like this go against everything that we have and continue to put in place to protect our health and well-being. It's by not following the guidelines that have been put in place for your health to protect you that we put all those around us in jeopardy. One wrong move, like some of the ones that we saw over the weekend and some of the patrons of George Street, can put us back on our plan of moving forward. I said it often since then that those actions were irresponsible and they cannot be tolerated. Measures are now put in place to address this. Our objective is to continue moving forward as a province, keep everyone safe as we learn to live with COVID. It's been difficult, it's been challenging, but we must learn to adjust together and continue to work together so that you can live comfortably around this virus. We know that we are stronger and we can be successful by working together. We've already proven that. Following the guidelines, well, it's not a sign of weakness. In fact, it's a sign of wisdom and a sign of understanding. So let's continue to be wise. Let's continue to protect ourselves and our families as we reopen our economy and reopen the social programs that we've been all used to. Now, speaking of moving forward, this week has been a very busy one already for us. On Monday, we announced the plan to return to school for the K-12 students in September of this year. It's been just over 3 months ago when the K-12 schools across the province suspended in-class instruction due to the COVID-19 pandemic. We saw similar measures that were taken both nationally and globally. Now, I know for most students and teachers, the last thing that you want to see us talking about today in July, in the middle of summer, is what return to school would look like in September. But given the fact that it's just really a couple months from now, the prudent thing to do is start preparing and planning for reopening of our schools. We know back and since March it's been difficult on parents, it's been difficult on kids who've been out of school, because what really this does is take you out of those regular family routines. As we know, school closures can impact physical and also impact mental health and well-being of our students. So our plan enables school districts and parents prepare for September and gives time to prioritize the safety and the well-being of students and school communities. It offers guidance to a wide range of operational issues. This could be things like physical distancing, hygiene and cleaning protocols, transportation, food services, curriculum outcomes, assessment and guidance for students with exceptionalities, amongst many other things. The plan is broken down into 3 scenarios. Of course, the optimal would be to return to school with health measures put in place, having all our K-12 system in classrooms. And depending on where we are, as Dr. Fitzgerald and others have said quite often, largely depends on the status of COVID-19 in Newfoundland and Labrador. So we could see a partial return in scenario 2 to in-school classes and possibly a full at-home instruction and learning programs. As I said, the preferred and anticipated scenario is to have students return to daily in-school classes. But this will be based on the expertise and the advice of public health and the information from across the country and around the globe. We also announced yesterday a significant investment in technology for the K-12 education system. And this is to make sure that students across Newfoundland and Labrador can thrive in their learning as we live with COVID. We provided yesterday some $20 million for the purchase of laptops for teachers. This gives teachers across the province, some 5,100 of those, laptops, tools they need to provide for remote online learning. Also was important that we get Chromebooks for the grades 7 to 12. So this allows our students to use the technology for learning, continuing learning, in case we need to close up schools. This investment will help provide equal access to education because not every single student in the K-12 system would have access to Chromebooks. So this is about helping our students regardless of their ability, where they live in our province, or their social economic status. So really it's about making sure students can continue their learning outside of the classroom. But it also provides students, as I said, the tools they need to deliver effective online remote instruction. So what we're doing is laying a strong foundation for the digital learning plan to create quality learning opportunities in an online world. Most of those students, this is all they know. They've grown up with this. They've known what it's like to use technology all their lives. So as we look ahead and plan for the next school year, we understand that technology can no longer be viewed as an add-on to education. It is central to ensuring teaching and learning can continue and be accessible from anywhere. So this is extremely important for students with exceptionalities. As we provide the opportunity for increased accessibility and expansion of supportive technology. So overall, the plan will support the implementation of a successful school year ahead while putting the education system, really after COVID, on a path to a digital learning environment. In keeping with putting supports in place, as I mentioned yesterday, for the education system, yesterday we also took some time and announced some $730,000 to partner with the Gathering Place to establish a temporary low-barrier emergency shelter. So anyone familiar with the Gathering Place would recognize and know the success they've had in dealing with some of the most vulnerable in our society. And this an idea that came from the collective spirit in the All-Party Joint Committee, whom I met with again this morning, along with Minister Haggie, as we continue to navigate our way through this unprecedented time. So they've been involved in this all along the way. The Gathering Place in St. John's provides compassionate street-level supports to some of the most marginalized individuals in our province. They have succeeded in creating a community support model, this is the Gathering Place, comprised of many volunteers, donors, and key players in our community for those who face significant and intersectional challenges. These challenges could be people who deal with trauma, it could be individuals who deal with mental health and addictions issues, people who find themselves living in poverty or involvement in the criminal justice system, homelessness or precarious housing. So the plan will work, and it will be an area for the Gathering Place will be converted into provide staffed emergency overnight shelter for up to 30 people 7 days a week. So what will happen is those individuals that need those overnight shelters can then access the services of the Gathering Place in the morning from 8 a.m. to 8 p.m. So what you see here is really a 7-day week, 24-hour access to service. What's key to this is that there's no precondition of acceptance to the shelter. The important thing is to remember that everyone, regardless of where they are in life, can be accepted as they are. Our goal is to work with and learn from the community partners to ensure our policies are rooted in harm reduction. It's also meant to mitigate the consequences of behaviors which are a significant factor in housing stability for some. We all know that giving people a safe shelter is very important in their lives. So we've been working alongside our nonprofit partners with the goal of improving our response for those experiencing the at-risk of homeless. Which included everything they need to establish a low-barrier shelter. So we've learned quite some time ago, going through the pandemic, that some of the most vulnerable in our society could not be assured of having the services that would be required. And given the fact that in preparing for a second wave in the fall of the year, we did not want to have ourselves in the same situation. So having this service available by September of this year is important. But it also highlighted the fact that we had to deal with this and action was required. That is why the Gathering Place played such a key role. But it didn't necessarily mean that we did not need to be supported by other partners, and homelessness of St. John's and the COVID-19 planning and protocols that has been put in place were also used, and we appreciate the work that they did in all of this, in the potential of preparing for what could be a second wave. All of this helps guide the planning which is underway for the design of a programming needs for what will be a permanent low-barrier shelter. So we put in place a temporary one for September this year. The planning is in place for the design of a permanent shelter, which will be needed. So COVID-19 is one of the largest challenges that we have faced, as you know, as a province. It's a test for all of us as our residents in Newfoundland and Labrador. Will be, as some people have already said, will be a time and certainly be a part of the history books that are written just not for Newfoundland and Labrador, but for all of us, regardless of where we live in this world. So as Dr. Fitzgerald said, let our actions today be the result of a good story tomorrow. Let's continue to keep our distance while remaining social and encourage you to stay safe, everyone. So I now pass it over to Minister Haggie for his comments.
Thank you very much, Premier. And again, no curve today, which is excellent news. And it speaks to the collective effort that Dr. Fitzgerald and the Premier have referenced about how people have followed the guidelines and we have shown the rest of the world really how this can be done. Unfortunately, as referenced by the Premier, some have not. And it really is a shame because it jeopardizes all of us and it really taints the efforts of a lot of bar owners, hoteliers and restaurateurs in St. John's and around the province who have worked very hard and in very imaginative ways. For example, if you go to JAG, they were featured in the media not that long ago for the way they have done their bar and restaurant. These premises, these businesses suffer by association with the likes of what happened on George Street. We've had a very collaborative relationship with Service NL and the Newfoundland and Labrador Liquor Corporation, which for us has been an example of how government departments can and should work together. There are 4 active complaints with Service NL stemming from Saturday and that video, and similarly the NLC is currently investigating from their point of view. And in actual fact, they seem keen on taking on the responsibility for policing this. And to enable them to do this better, while we've written guidelines, which most people have followed, later on today, in respect of bars, those will be changed to orders to enable the NLC to take a role in this. They would do that under their mandate, under the Newfoundland Liquor Act, and you'd have to speak to them about what exactly the sanctions would be there, but I do know they have the ability to control a bar's license and can pull it if need be. So we're taking this very seriously, and I'd like to thank Minister Osborne and his team in both Service NL, Alan Doody and Sean Ryan in NLC. So that's been a great example of how we can fill in loopholes. In terms of the Department of Health, the topics of interest currently at the moment relate to around how the healthcare system in general is ramping back up to deal with people who have been waiting and the backlog that was created by the cancellations at the beginning of COVID. As of last week, which is the last full week for which I have figures, for example, lab services across the province were up to 84% of normal, diagnostic imaging at 78%, and surgeries had already achieved a 76% return to pre-COVID levels. The issue around endoscopy, that's up at 73%. Cardiac surgery, which is provincially done here in St. John's, is already over 80%. And our targets were for 85% in terms of bed occupancy by this week. But you can see some of those areas do not impact inpatient beds. Eastern Health, for example, has added additional hours for the CT scanner at the weekend to deal with the backlog and wait times. Overtime, they have been instructed, should not be an issue if they need to incur it. So there are robust mechanisms in place to approach this backlog and these wait times. With regards to primary care, I've asked the regional health authorities, and as of today, they report that all RHA facilities providing primary care are very nearly at 100% of capacity. The preferred option, in line with our previous recommendations, is that these consultations be done virtually, but there are provisions and ease of access for those individuals for whom the physician or nurse practitioner feels a face-to-face examination or discussion is warranted. Bed occupancy has been a topical issue, and as of yesterday, Eastern Health sits at 81%, Central Health at 74%, Labrador Grenfell at 86%, and Western Health is at 81%. With regards to those people who receive primary care through private fee-for-service offices, then obviously we would encourage them to follow the lead set by the regional health authorities. The other issue that was and still is the hardest I've had to deal with has been around visitation. We have a very vulnerable group of seniors in our province, in long-term care facilities, in community care homes, in personal care homes, who need to be protected. And it has been very difficult to balance risk of exposure to COVID with the need to protect them and ensure their emotional well-being in terms of connecting socially with their family and circle. So in the light of Dr. Fitzgerald's recommendations around expanding your social circle, as of the 13th of July, there will be an increase in visitation both in acute care, long-term care, and recommendations for the private operators of community care homes and personal care homes. And in line with Dr. Fitzgerald's recommendations, each resident or each inpatient will be able to have up to 6 designated visitors. We have, we think, solved the issue of hairdressing for those individuals and those residents in long-term care who have been challenged with that. And the regional health authorities have facility-specific plans now in place to deal with that. The personal care homes and the community care homes are obviously private institutions, so they have some discretion and often do ask for additional requirements, and that is their ability, that's their right to do that. They now have the option to take their residents out for short periods, up to a day, for essential services, hairdressing, visiting family, and these kind of things. So we hope that that will help ease some of the burden that has been borne both by the families of residents and the residents themselves. And again, just like in other areas where we're opening things up, that there is always a tension between those people who feel we are doing too much and those people feel we're not doing enough. So we hope this strikes a balance. The details will be facility specific in terms of long-term care, and I would recommend that families contact the facility management to find out the specifics for their loved one in that circumstance. Acute care, there will be advisories in the public domain to follow. Another area that was particularly topical in acute care was the issue of support people for antenatal and prenatal ultrasounds, and as of Monday that will be the case. Such support people will be able to go in with their loved one. So again, further steps towards what will be our new with COVID, life with COVID normal, and happy to keep these updates coming on a regular basis. But in the meantime, I would recommend you recall Dr. Fitzgerald's advice about people, space, time, and place in determining your own level of risk when entering any particular situation. We've done so well so far, and I have complete confidence that we will continue to do so, even in the face of the odd case of COVID to come. So thank you very much, Premier.
Thank you, Minister, and thank you for that good news. Is I think what we've all recommended and we've all become accustomed to in recent weeks is that there is a gradual approach as we do this, making sure we protect one another. So thank you for that update today. So with that said, I will now turn it over to the media for today's questions.
Thank you, Premier. For the benefit of our speakers, we have 5 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Minister Haggie, it's great the NLC is stepping in here and wanting to help out in terms of enforcement as well as service NL, but in terms of the George Street issue, we heard very early on throughout this that there could be fines, all of the guidelines that were followed. We were given a warning last week from Dr. Fitzgerald in terms of what she was seeing. So why is it that this has to go to the NLC and to Service NL? Why can't public health step in here and lay a fine down in light of what we've seen?
The health department and public health as such, through environmental health officers, has the ability and the authority to regulate under that act. In terms of enforcement of special measures orders, the summary offence tickets can only be issued in this province by either the Royal Newfoundland Constabulary or the RCMP. Discussions today, particularly around, and yesterday around George Street and bars, the Newfoundland and Labrador Liquor Corporation felt that they would like to step up and deal with this, and that's the route that we felt across government would work with that industry. It's industry specific. NLC inspectors know that business, and at the end of the day, they have a very collaborative relationship, I'm told, with license holders. And I think the threat, the possibility of losing one's ability to make a living is something that will really focus people's attention.
Thank you. The contradictions for the guidelines, there's too many to mention, really. Do you believe that this erodes the public's faith in your messaging? Does it weaken it?
We have a partnership. We in government can make recommendations, and the Chief Medical Officer of Health can institute special measures orders under the state of emergency. But everybody has a part to play. It's not something we can mandate from here. There is a role for individuals in assessing their own risk and their own responsibility. There is a role for business owners in the way they conduct themselves. And you've seen, by and large, there have been some marvelous examples of cooperation. I mean, you go to Dominion, you go to the NLC in Gander or Foodland, and it works. There's physical distancing, there is no crowding, and it works. And every once in a while, you will end up with people who disregard that. And those are our challenge. Equally, and not in necessarily this case of the bars, but there is a considerable amount of misinformation and stories that are out there on social media that have burned up an awful lot of administrative time tracking down, only to turn out to be will-o'-the-wisps. The overseas, the out-of-country license plates in Bonavista, Vista, the mythical flood of Texas license plates off the ferry in Port aux Basques. None of these have actually borne fruit, and yet they are out there, and that's why Mystics Peyton at the beginning says, you know, try not to talk about rumor-based questions. We've spent a lot of oxygen over the last 3 months talking about rumors.
Thank you. Dr. Fitzgerald, my final question for you here. Did the Chief Medical Officers of Health from the Atlantic region kind of sit down before this bubble and maybe discuss some of the guidelines as they vary so much province to province? For example, in Nova Scotia, you can have up to 200 people indoors. Here, we can only have 50% capacity to 50 people. I'm just wondering, is there any discussion to start to align some of the restrictions from province to province?
As of right now, prior to the Atlantic bubble, I should say, the Chief Medical Officers of Health sat down to discuss the Atlantic bubble and what that would look like. What would be required, moving province to province, that sort of thing. With regard to the individual rules, regulations that are in each province with regard to mass gatherings and things like that, that's not something that we discuss. That has been, those have been developed within each province, in each province's local context. And so there hasn't been discussion in that regard. Certainly we discuss the pros and cons of each, but ultimately we all have to make our own decisions based on what we feel is the best information for us and what the best path forward is for each of the individual provinces.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hello, happy Wednesday to you. I'm wondering about the NLMA's press conference, the second they've done in a week yesterday, and they say they've been frozen out of discussions or notification even on restarting health services. Why is there such a lack of communication, and why are their concerns just seem to be falling on deaf ears?
I think I would take issue with a lack of communication. It may not have been me each time, but people in my department, by and large, speak with or meet with virtually representatives from the NLMA usually twice a week, occasionally 3 times a week. It's not that long ago that I sat down with the new incoming president and the current president and CEO, virtually speaking. And really and honestly, I'm not sure that I would accept the premise of that question, Peter. I don't know of any other group in healthcare, association or professional group, that has had as much face time with the Department of Health as the NLMA. Indeed, I would argue, and I think I could prove, that the NLMA have had as much or more face time than the next 2 or 3 associations combined. So I really can't explain where that's coming from.
Okay. And with regard to bed occupancy, which, the NLMA says is not a very good measure of overall health startups. You gave some more itemized updates today on certain procedures and stuff. Would you or the health authority or someone try to mandate this being a regular, transparent offering to both doctors and patients?
I think that's an excellent idea. We're working with the Newfoundland and Labrador Centre for Health Information. If you notice, we kind of pioneered the dashboard approach with the COVID data when the COVID website was first put up. And several of us sat there and said, well, hang on, why don't we do this on a regular basis for health system metrics, for example? And one of the points of discussion that we actually had with the NLMA and I had with the 2 presidents was how we get decent wait time data from their offices and the RHAs and put that up. So you know as a patient, as a primary care provider, that if you're referred to Surgeon A in St. John's, you're going to have to wait 3 months for an appointment. But if you're referred to Surgeon B in Clarenville, you might only wait 3 days. That kind of data is so useful. I'd love to have it up there. And once we get a little bit of capacity as the COVID demands start to fade in the acute area and we start to work on these systems engineering pieces, it'll be a crucial step forward. I think we could lead the way nationally on this.
Okay. And the last thing I wanted to ask was about your changes to visitor restrictions. Can you outline again exactly what you're doing in terms of designated visitors at seniors' homes and people accompanying patients? Can you spell that out again? I just want to make sure I understand.
Certainly. I mean, as far as people being accompanied to acute care is concerned, for people with disabilities or challenges, we have always stipulated that a support person can be present as often and as long as is needed. Ideally, the same support person, just simply to reduce the number of individuals. We heard very clearly that an area of challenge was that of antenatal and prenatal ultrasounds. So we have specifically included a support person for those visits. In terms of visiting more generally, we have adopted the number 6, which came from Dr. Fitzgerald's recommendation about extending one's social circle based on hard science about the number of different contacts in a day and the level of risk associated with it. 6 is an acceptable point. So as a resident, for example, of Carmelite or Lakeside Homes, a long-term care facility, a resident there would designate a list of 6 individuals who would form that kind of panel of visitors. The actual mechanics in terms of visiting time and the location within the home, whether it's a meeting room or visiting room or whether it's at the bedside, that would be facility and patient specific. But 6 is the number, and that will also apply to inpatients in acute care.
Thank you.
Our next questions are from Tyler Dunn of VOCM News. Please go ahead.
Thank you. You talked a little bit about the meeting with Service NL and the NLC, saying that the plan might come out later today or is going to come out later today. I'm just wondering if you have an idea or could give us an idea of what these measures and orders might look like.
I think from the point of view of the requests from NLC, for example, they were issues about capacity with restaurants, for example, Dr. Fitzgerald recommended that they operate but at 50% capacity. Nova Scotia, which we're being compared with, actually has a similar constraint. They don't put a number on it, but you've got to sit 6 feet apart, so that limits you. So we will be coming up with a recommendation based on their previously licensed capacity and amending that in the light of COVID, for example. There's also some other wording, which I can't remember offhand, but we can certainly, it'll be apparent when the order comes out later on today. It's on the advice of NLC inspectors to make it more inspector-friendly.
Okay. And one individual who traveled to the maritime provinces from the U.S. is believed to be the cause of the 5 cases recently announced in PEI. As the province does open up and more people do gain access, I'm just wondering, are there any repercussions that exist in this province for people who are supposed to self-isolate on arrival but then do not?
Well, I think when you look at what happened in Nova Scotia and in PEI, this was indeed an international traveler with a final destination that was going to PEI. So they had landed in Halifax, went to was picked up by a family member there, and then, continued to travel to PEI. Well, then they were stopped at the border in PEI. Proper paperwork wasn't done, so they went back and self-isolated in Halifax. And this is where the positive test came from, which led to, the example that you gave in PEI. None of the changes, even with the opening of the Atlantic bubble or around travel restrictions, has really changed there in Newfoundland and Labrador. If you're coming from outside of the Atlantic bubble, it's self-isolation for 14 days. That has not changed. The documentation is still required for an exemption order if you want to visit our province from outside of the Atlantic bubble. So all those travel restrictions stay the same, and even the documentation that's required when you come into Newfoundland and Labrador at all our borders, they stay, they're still in existence. So for us, there's been very little change in what's been happening prior to the Atlantic bubble and where we are today. And I think the officials within all of the maritime provinces in New Brunswick, Nova Scotia, and PEI will clearly say and articulate that what happened with this traveler was not at all connected to the Atlantic bubble, 2 separate scenarios altogether. So they got in as an international travel through the federal rules, landed in Toronto, asymptomatic, moved on to Halifax. They were turned away at the PEI border where they later became positive. They were self-isolating.
Okay, and as well, Premier, the back-to-school plan, some people are saying it's a little vague, and critics are saying that it puts too much on school districts and teachers. How do you respond to that?
Well, it's important that we all work together. I think there's one thing that we all agree to, is that everyone wanted to see a return to school in September of this year. Is we realize that, the in-classroom education was something that was the preferred option. But we also had to plan for a scenario of not exactly knowing where we could be at this point in time in the fall of this year. So making the investment into technology for laptops for over 5,000 teachers and some 37 children within our students within the K-12 system, the grades 7 to 12, would receive Chromebooks. That was the investment into technology in case we needed to use other scenarios. So right now we put the plan in place, and then that's the rollout. The implementation will require consultations with NLTA. We've made that commitment that we would work with teachers. Also, people around busing and what that would look like in the fall with the school reopening. Also for those that are responsible for cleaning schools, there will be work that will be done with them. But laying out the plan and what will be provided by government, working with the school district, and then reaching out and working with all our partners who will have valuable input in what September would look like, realizing that we all want to see schools open. So this is not about, government making this decision or the school district making this decision. This is about creating a path and a framework for what would look like eventually into the September and the fall semesters.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hello. Premier, first question is on the border. Is it still the plan, or is it the plan to open the border to the rest of Canada on July 17th?
No, that's not a discussion. What we said is that the Atlantic bubble on July 3rd, The earliest possible date that if we were to expand this would be the 17th of July. We're not having any discussions on that date yet. We would continue to monitor. We know that around the province right now, there's considerable fear, I would say, in opening up those borders. We recognize that from a Newfoundland and Labrador perspective, that the areas that we line up and have more travelers that come into our province would be from provinces like Alberta, provinces like Ontario, but before a decision would be made on expansion of any travel, we would be working with public health based on the epidemiology of where that would be, continue to monitor. There's no date set for when that would be. The only thing that was significant about July the 17th, that would be the possible earliest date. So we'll continue to work with public health, continue to work with other provinces, and continue to monitor very closely what's happening around the country before any decision is made. First and foremost, so I can assure people in Newfoundland and Labrador, it will be the safety of Newfoundlanders and Labradorians that will be the priority and will be what will influence a decision that's made by all of us before we open up any more and ease any more travel restrictions.
Okay. Well, just to clarify, so is it still possible that the border could open up to the rest of Canada on July 17th? And if that decision is made, how much of a warning in terms of timing before that would happen would the province give?
What we've always said is that it's important that we always give a bit of a lag time and advance notice before we would do that. So we would see what's happening within the maritime provinces. We just mentioned things that were travel related, not related to the Atlantic bubble. And I think I want to reiterate and reinforce, what we've seen recently in PEI, New Brunswick, and within Nova Scotia, rather, that these were not related to the Atlantic bubble at all. This would have occurred, as an example, with exemption orders in Newfoundland and Labrador, we're over 9,000 people that will come into our province through the exemption orders that has been put in place, and they've been very effective. There's about 15% of those that have been denied. Over 9,000 people have applied, 15% have been denied access to our province. So there's still people coming in. And keep in mind, we have a lot of Newfoundlanders and Labradorians that leave the province to go visit families in Alberta and Ontario and other places. They can leave. There's no restrictions on leaving. The restriction is when you come back. And it's still in place now. If you come back from a visit outside of our province, outside of the Atlantic bubble, you must self-isolate for 14 days. If you're from Alberta or if you're from Newfoundland and Labrador, that is the restriction on travel when you come back in. So right now, there's no decision on when that date would be, even if we would open up to outside of Atlantic Canada. So to want to be saying that, it's July 17th, that would have been the earliest possible date, but we've made a commitment that any changes that we would give, all those will be impacted by this, some lead time before a decision will be made. We're not in a position to make that decision today.
And finally, on the school plan or the plan for reopening schools in September, there's a lot of new responsibilities for school custodians. Are we going to have more permanent full-time, or are there going to be more full-time custodians in schools as of September because of the new responsibilities that they've been given under the plan?
Well, the implementation and how things operate, the logistics about operations within the schools will be the responsibility of the school districts. You could even take this down to the school level, because not every single school is the same, as we know. In Newfoundland and Labrador, classroom sizes, the size of the school can vary depending on the community that school is located. So the school district will work very closely with those individual schools, with people like the principals and administration that's in those schools. So the idea here is to roll out the plan on the broad strokes of that plan, then roll it out from an operational point of view, working with the school district, working with individual schools, working with NLTA, our busing services, and those custodians will play a very critical role in what the rollout will look like. But as I said, it's safety first. That's the priority, protecting our students, protecting our teachers.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Thank you. Dr. Fitzgerald, larger cities like Ottawa and Toronto are now making masks mandatory. Anecdotally, mask usage in this province continues to be quite low despite the recommendation that people should wear them. Are you considering making mask wearing mandatory here?
So mandatory mask wearing is, it's not a simple yes or no question or answer. You know, there are things to consider. There are people who may not be able to wear masks. So if it's made mandatory, then if you don't wear one when you're in a public space, then, you know, you're not compliant with the law. So that could have repercussions for people. So we have to consider things like that as well. Certainly, the expectation is that if you're in a public space and you can't maintain physical distancing of at least 6 feet, that you would wear a mask. I expect that people would do that, and realizing that, you know, we do have the compliance with mask wearing is not as high as we'd like to see. I certainly haven't seen a lot of it myself when I've been out around. So really at this point, our recommendation still remains to wear when you're not able to physically distance, when you're on public transportation or in public buildings, and in workplaces if you're not able to physically distance as well. But at the moment, no, we're not considering mandatory masks. As things change and as our prevalence if we have a change in prevalence of COVID-19 in the province, then, you know, we may have to reconsider that position.
So we're at alert level 2 right now. How many weeks are we looking at until moving to alert level 1, and what will alert level 1 look like?
So we haven't made a decision about that at this time. We've had a lot of changes. A lot of things have opened. And in some regards, things haven't gone as smoothly as we would like. So we want to make sure that we're not, you know, we want to give it time to make sure that we're good to move to another level. But, you know, there's a lot that has opened. There's not a lot more to open. I think with alert level 1, we'll be looking at more how we're living life going forward until we get a vaccine. So, you know, I want people to understand that level 1 is not going to be sort of normal as we knew it prior to COVID coming on the scene. Level 1 is going to be we're still going to have to practice physical distancing. We're still going to have to consider wearing masks when you're not able to physically distance. All of those same personal public health measures are going to be in place. There's not likely going to be a situation where we'll be able to have large mass gatherings. So we need to remember that, you know, what we have right now, what we're doing right now, is largely what's going to be normal until after we have a vaccine that's effective against COVID-19 and that is available and accepted by the majority of the population. And by majority, I guess I really mean more than 70 or 80%.
And Dr. Fitzgerald, we heard the Premier just talking about opening travel to the rest of Canada. You've been looking at the epidemiology of the disease elsewhere in the country. Do you think it's realistic that a week and a half from now that epidemiology could be to the point where the risk remains low for travelers from other provinces?
So we are monitoring it regularly, and certainly we have seen you know, improvement in a lot of areas through across the country. We've certainly made gains. A lot of the provinces that were having difficulties have made a lot of gains. So, you know, I think we're moving in the right direction. But as we've seen with COVID, things can change quickly. So I'm certainly not going to predict, and I think you guys know that by now, that I'm not going to make predictions. So we're going to see what happens.
I just want to reassure everyone that these decisions are not taken lightly by everyone. And I know there's been a lot of comments that have been made around the Atlantic bubble versus political versus public health. Well, I can assure everyone, you know, that's watching this today that the decisions that are made are not political. They're based on the science and the evidence and the advice of public health officials. So that's the way things work at this table, and that's the way they will continue to work at this table.
We have about 10 minutes left, so we could get a quick question from each reporter. So I'd ask that you keep your preamble short. And we'll start with Kelly
Thank you. Minister Haggie, you note long-term care visitation opening up on July 13th. Why that date of July 13th?
In keeping with a lot of the changes that we've made, we've got a lead time there to allow those details to be worked through with families, to arrange who it's going to be on the 13th that goes to visit Nan. So I think that's the simple reason to do that, is to give everybody notice to prepare.
Thank you.
Our next question is from Peter Jackson of the Telegram. Please go ahead.
Hi, I just wanted to get a quick question in about schools again. Technology is not very effective without the skills to use it. Will training on educational software and virtual teaching practices be provided to go along with all these laptops that are being purchased for teachers and students?
Yeah, so professional development as well as the procurement of those laptops and Chromebooks for grades 7 to 12 will be an important piece that we've been able to. This is the most significant investment that you've seen in technology to the education system in Newfoundland and Labrador that we've ever seen. And this will set the foundation for digital learning even after this pandemic is over. So this is important. So part of all of this, of course, will be professional development for teachers around laptops. Although I will say that, most teachers that we have in the system right now are, very used to using technology. We've had smart boards in our classrooms now in a number of schools for quite some time. So the technology and the introduction of technology in our education system is something that's been evolving. So adding the additional laptops for some 5,100 teachers will be a little new. These will be the tools that we put in place, but they've been using personal devices for quite some time, and we thank them for that. So right now there will be some training. I would imagine that will be required. So professional development will be in place for our teachers, as well as those students that would not be using Chromebooks before. There will be some adjustment. But as we all know, as I said, most of those students have grown up using technology. They've been using this for many years. So this will be a new way of doing things, but new to us, but not so new to the K-12 system. There will be some adjustments, and we'll make provision for that.
Our next question is from Patrick Butler of Radio Canada. Please go ahead.
Hi again. Just wondering, because we're talking about when we're talking about the school plan, how the decisions will be they'll be made by the school districts. Understand that, but are the school districts expected to make the changes that were included in Monday's plan within their existing budgets, or beyond this $20 million announced for laptops, is there going to be extra funding given to the district?
Well, first of all, I think let's not get ahead of ourselves here. We need to start the consultation. Let's see what's required. We've added some 350,000 resources to the school, or 350 individuals of resources to the school, to the education system. This will include this fall as part of our action plan. Even without COVID, we were making some changes, and there's 100 instructional assistants that will go into the school system this year as additional teachers, reading specialists, mathematics specialists, and so on. So this will bring a total of some 350 additional resources that went into the school system in the last 3 years. So will we let the plan evolve? The plan's out there now, the consultations with all the partners that are significant to this. We'll let that roll out to the school district, and we'll see from a budget component where we find ourselves in the fall of this year.
Our next question is from Tyler Dunn of VOCM News. Please go ahead.
Just back to the NLC and the Service NL measures. Do we know what time those measures are going to be released to the public today, and what the measures entail? Will they be implemented immediately?
I missed the beginning of the question, but if it's related to the rewording of orders to enable NLC to operate more efficiently in policing bars, my anticipation is that will be done by the end of the day. As I say, some of the detailed language is coming from them to enable us to make it more efficient.
Okay, thank you.
And our final question today is from Peter Cowan of CBC News. Please go ahead.
Thank you. Dr. Fitzgerald, I'm wondering if I could get your comments on the scenes that you saw on George Street over the weekend And do you think that the changes that were made around NLC inspectors will mean that this weekend looks differently than what we've seen for the past couple weekends?
So, obviously I was quite disappointed with what happened down on George Street this weekend. I feel that, we've been very clear. We provided clear guidance to bar owners, and we were very clear with people all along what we expected of them. But unfortunately, when people may celebrate a little bit too much, sometimes the, decision-making ability is impaired. So that's unfortunate, and I think certainly what we've had some productive meetings with the George Street Association. I think we've come to an understanding of the expectations, and I believe that they are as interested and as eager to make this work as we are. So I'm very encouraged by the steps that have been taken over the last couple of days. I think that tightening up the order to allow these the inspectors to go in and to do what needs to be done will be helpful. So I'm encouraged by all of this.
Thank you.
Thank you, Dr. Fitzgerald. The time for questions has ended. Please join us again on Wednesday, July 15th at 2 p.m., 1:30 in most of Labrador. Have a great evening, everyone.